A warm welcome to everyone on today's Symposium on Women's Health, organized by IISc iGEM team on the International Day of Action on Women's Health. Today, we gather here to collectively explore the frontiers of women's health, examine the challenges women face, and celebrate the progress made thus far. It is a testament to our commitment to ensure that women have access to comprehensive and equitable healthcare and are empowered to make informed decisions about their well-being. The International Day of Action on Women's Health serves as a poignant reminder that women's health is a fundamental human right that must be safeguarded and championed. It is a call to action, urging us to confront the barriers that hinder women's access to quality healthcare, tackle the persistent gender disparities, and address the unique health needs and concerns of women across the globe. To inaugurate the symposium, let us invite our first speaker, Dr. Supraja Chandrasekar, Senior Consultant, Pediatric Intensivist at DHEE Hospitals, for the talk, Just Another Woman in Healthcare. Thank you for joining us today, ma'am.
Thank you so much, Shloak. Thank you for the opportunity. I'm quite honored to be part of such an intellectual crowd. Here, being a woman, representing women's health, working in healthcare. I just thought I'll take an offbeat subject, not necessarily related to women's health, but I work in the healthcare industry, and I just wanted to take a small snapshot of the journey that it has been for me. So I start with a disclaimer. I am absolutely ordinary, but ordinary people can sometimes have extraordinary experiences that have shaped their lives. So I would just like to share a few of the experiences from my childhood onwards that has made me what I am today. I come from a humble background, that's my little sister, and we are from a simple middle-class family. No big dreams, just wanted to do the best that we can. I remember in school days, I was not very good at all initially. That was me in 9th standard. And I was interested in dance, music, and various other things, and was very super ordinary when it came to academics. In 7th standard at Sophia's, we had to make a choice to go to IISc or SSLC. The unsaid word was those who didn't do very well used to take up SSLC, and those who were high performers would automatically choose IISc. So there was no doubt that I would do SSLC, and I went to my parents, got it signed, didn't even tell them that there was an option, and I submitted the form. My teacher called me the next day, and I thought, oh God, why is she even calling me? I actually submitted for SSLC and nothing else. She called me and she said, I think you should change to IISc. I was shocked. I just kept staring at her. Her name, Mrs. Shamla Gopinath. And she said, there is more to you than what you think there is. Just take up IISc. You might do well. Those little words said to me changed me completely. And I thought, why not? And in 7th standard, I put in my best effort in a different trajectory. And from nobody, I passed out as the school topper. It meant a lot to me. And that's when I wanted to do well in academics from there on. So I told my dad I want to be in an academic college. Probably, if most of you are from Bangalore, you would know that MES college was one of them. And he said, well, no, I want you to be an all-rounder student. So no need to go to MES. What is close by to our home is Mount Carmel's, and you join. And I thought, oh God, what is going to happen if I join Mount Carmel's? I would do various other things apart from studying. But what I learned then was you never know your strength till you are put to test. And Miss Shamla Gopinath got me through this journey. Well, I did join Mount Carmel College and I did my best. I would never forget 2nd PUC, the day they are going to announce the results. 7 a.m. they said the results are put up. I didn't even want to get onto my dad's scooter saying that I don't know, what if I do badly? I did try. I'll never forget his words. He said, Karmanyi vadikaraste ma paleshu kadachana. It is not the outcome that we are supposed to chase. What we are supposed to do is just our effort. So go and see whatever the result is, it doesn't matter. I happened to do well, happened to get a very good rank, and that got me into my temple, Bangalore Medical College. Never once thought I'll be a doctor, but always wanted to be a teacher. And my dad said, how many of us get an opportunity to teach and be a medical doctor? Why don't you take it up? And that's the journey in BMC. 5 years was a dream, a beautiful learning experience. And in no time came the degree MBBS. I really liked every moment of it, so much so that I definitely wanted to join Vani Vilas Hospital, which was the children's hospital associated with Bangalore Medical College. It was my dream to crack the Indian entrances and, somehow get into pediatrics. But life has a lot of turns. And that's when Dr. Chandrasekar came into my life, got married. And I thought, okay, he is also from Bangalore Medical College. In fact, even working there, things are going to be set. But he said, I've done enough in India and it's time to go abroad and explore new possibilities, get higher training. And he wanted to go to the UK. So I had to switch gears and study for the entrance exams abroad. Not very willingly, because my dream was in India. I'll never forget the day of the marriage was the day of the results of the PLAB exam to go to UK. Things went well and reality brought us to London. His job was fixed. He had already got a job in London and in orthopedics, which was his passion, and he was doing well. And I wanted to do pediatrics. I don't have any pediatrics training in India, and it was tough. One application after another, weeks, months, 6 months, and no job, because it's difficult for a fresher to get a job in a specialty like pediatrics, which is high risk. So then my husband suggested, why don't you do any other thing? Why don't you do medicine? And I said, no, I love pediatrics and that's what I want to do. So he suggested, do emergency medicine. We will see children as well and probably then get into pediatrics. And thankfully, that's when my first job came in the outskirts of London called Basildon. And I went into emergency medicine knowing nothing about it. And there I see this big man, Mr. Abdullah. And he was extremely strict. Looking at me, he said, new joinee and knows nothing about emergency medicine. Do you think you can do it? Well, I have my own doubts. I was petrified, thinking, how am I going to do adult medicine? But the only solace was that I'm also going to see children and sick children. So I need to put my brains at work. Emergency medicine was a whole new world because it was a world where teams work together. There would be about 10 to 12 people resuscitating a single child. It was like magic when they became better. It inspired me so much that I used to study pediatrics on my own and even took up the advanced pediatric life support course. Many people discouraged me, saying that without even working in pediatrics, there's no way you can pass the exam. And I went to a center in St. Thomas's in London, which is one of the best centers. And I cracked the exam, did well, came back to Mr. Abdullah, and he was stunned. Not just that, I got into a rotation training in pediatrics. My dream come true. So life challenges you only to give you an opportunity to become better. That was the next lesson I learned. So the next part of the journey was doing pediatric training at Birmingham Children's Hospital and its associated hospital. A beautiful journey of learning one of the most fascinating things about children. And just when I had to give my final exams, well, there was a birth of this little one. What to do? Cannot postpone the exam. Want to give it my best shot. And did well, passed in my first attempt. My next lesson, for a woman, personal and professional lives are intertwined. We just got to do it. And just when I thought we were settled in UK and Everything in Britain was now appealing. I got my dream job, finished MRCPCH. Now I can go to specialty training as a specialist registrar. So I felt we were settled in Britain. That's when Dr. Chandrasekar said, well, India is calling. We have our training. We need to go back and do something there. Build a setup and utilize our expertise. So there was another shake in this journey. Yes, we reached India, and I took up my first job at a government or a semi-government hospital, the prestigious Indira Gandhi Institute of Child Health. Well, there was a world of difference between the setup in the UK and here in India at a government hospital, but it taught me a lot. The whole spectrum of infectious diseases in India, the whole realm of affordability and lack of follow-up, and so many other challenges that Indian children come with. But it was exciting. From there on, moved to Narayan Hridayalaya as a pediatric specialist registrar. At that time, I had a glimpse of their beautiful ICU. That's when I realized my calling was in intensive care. Now, connecting the dots, that first job in emergency medicine did play a role to inspire me to take up what we call acute pediatrics. And I so much wanted to do ICU. For that, I needed to apply for the National Board of Pediatric Intensive Care. But again, there was a problem. Since I was trained in the UK, MRCPCH was not yet recognized as a degree to apply for the exam. I thought, oh God, I can't let this go. ICU was too exciting for me and I wanted to do it. So my senior suggested to write to the board. Well, I wrote to the Council of Indian Academy of Pediatrics. I will never forget the then Chancellor's words. She said, our national exams are tough. If you think you can pass, then we will give you permission to attempt. And I thought, oh God, this is one chance that I get and I need to do it. So I applied for the fellowship interview. And that was my boss, Dr. Rajiv Agarwal in Narayan Hridayalaya, who took my interview. And he said, well, you've just come from the UK, you hardly have any experience, you have a small baby to look after, and why would you want to do intensive care? It's going to be extremely difficult. But I said I did want to. And to that, he responded, "Tu alternate days night duty karegi kya?" I would never forget those words. Alternate days, staying overnight in the hospital, that is a lot. So I excused myself from the interview, went outside, quickly called my husband and said, "Do you think I can do this?" He said, "Well, do you really want to?" I said, "Yes, I think intensive care is where I want to be." He said, "We'll manage. Just do it. But you have only 1 year. We can't prolong it further." So I worked really hard. And true to his word, we actually did every alternate day, staying in the hospital almost for 24 to 36 hours, and were back again with just a few hours of rest. Hardly gave time to family and baby, but my entire family look after. Not only did I pass the exam, I won the National Gold Medal. That was only because of all the challenges that were put. So when you want something and work for it strongly enough, the universe conspires to give it to you. That was the next lesson I learned. From there onwards, we decided to start our own hospital called Peepletree Hospitals, which is in this area. And Dr. Chandrasekar, the founder member, had a dream to start a doctor-driven hospital. And it was lovely coming together with so many specialists, doctors, with a common dream. And the next 7 years was brilliant in building the pediatric department. Not only did we do excellent clinical work, but we also did a lot of training, simulation, and went notches above in starting even fellowship programs. However, due to various reasons, we had to exit. Peepletree did not have the same ethos that we started with. So then I joined Manipal Hospital just 3 years ago and continued my journey in pediatric intensive care. One of the most beautiful things happened later on. 25 years after joining Bangalore Medical College, they called me back to my alma mater to give a talk and train the students on simulation. It was such a wonderful feeling to go back to your college and to be part of the journey of training. I took it up with lots of love and passion. And this was during the exercise of simulation training, which we do for the young graduates. One of the boys came up to me and said, "Ma'am, I know you." I was a bit puzzled, thinking I must have seen him in some wedding. And he said, "You treated me when I was a child in People Tree." Isn't that beautiful? What else does a doctor need? He is now become a young doctor. That was so wonderful. So children definitely shape and change our lives. I want to take a few minutes to explain the few children that changed my life forever and the lives of our team. I'll start with this girl from Rajasthan. So she was a girl who came to us with severe bleeding when she attempted to eat, when she passed stools, and even blood in her vomit. She was emaciated. We thought she would never make it. I was so angry with the father, thinking that because it is a girl child, he has ignored her and not given her any treatment. But I was sadly wrong. He did everything possible there in that remote village to get medical care, but nobody could understand what was going on. And someone said, go to Bangalore and, get better health care. So they landed up in my previous organization. And when I was looking after her, we realized that we would lose her because she continuously bled from the intestine. We had to take up for emergency surgery. And that's when we sent for biopsy, we understood that she had tuberculosis. That is a treatable condition. So we did not give up on her. We started her on medication. Look at her. This is her spirit. Even though she's on high flow oxygen, she's having all those various cannulas stuck in her neck and she has a tube in her nose, she waves out to us and says, I want to live. I want to eat my dal khichdi. And that's exactly what she did. A few weeks later, when she got much better and was off respiratory support, she definitely showed signs of improvement. And within a month, she was out of hospital. Not just that, every Diwali, they send me her picture on how beautifully she's growing. These children teach us a lot about resilience. Look at this little fighter baby. He presented to us during the peak of COVID time in my previous hospital, where he came with lethargy, was unable to eat and unable to drink even breast milk. He was just about 1 year. Mother did not understand what happened to the child, and within a day, he completely collapsed. And when he came to us, he had high acid levels in his blood. We didn't understand what happened. During that COVID time, we had to, our protocol was to do a rapid antigen, and he was positive. So everybody said he is COVID positive and COVID had done this to the child and we would lose him. But we know COVID in children is very mild. There was something else we were missing. Why would COVID make this child so sick? When I looked at the child closely, I could see that his toes were very black, his knees were very dark, his tongue was beefy red, and that was screaming of a vitamin deficiency called vitamin B12. So we thought, I said, let me send the vitamin B12 levels. And to my surprise, it came 0. It was actually completely nil. Now, vitamin B12 is a very important vitamin that is available only in animal sources. Like vegetarians get that only from milk. And what I learned is mother had recently become vegan and she was breastfeeding. She was vegan for about 4 months. And what she didn't realize, the little baby was not getting any vitamin B12 at all from the breast milk. And he wasn't eating anything else apart from rice-based foods, which did not give him any B12. Once the vitamin B12 levels go down, it causes catastrophic changes in a little baby, especially when it goes down to such low levels. It not only increased the acid, it made all the nerves dysfunctional, and the child had to be on dialysis. Well, since we recognized the problem pretty early, We ignored the COVID, gave the vitamin B12, and look at him, just in one day. He's sitting like a little prince with that dialysis catheter right there sticking from his belly. He did extremely well, and in no time he went home waving bye to us. So it was not the COVID that bothered him. It was a simple vitamin deficiency that parents were unaware about. The next is about a girl who showed us what the real meaning of grit is. Now, this child was an adolescent girl who came from Tumkur district, and she presented with headache and vomiting, and everyone just treated her for a viral fever. But we realized she had meningitis. Now, meningitis, as you know, is an infection of the brain, and we started her on antibiotics. We counseled the parents and said she will get better. She was only having 5 days history of fever. But on the 6th day, when I looked at her, as you can see, her eyes, they were already, looking like she had a squint. She was normal before this. And that's when we realized that there were changes happening in her nerves inside, and these were suggestive of tuberculosis. Although she was a well-grown child from a well-to-do family, TB can affect anyone in India. Once we started tuberculosis treatment, she did extremely well. Not just that, she was in her 10th year, again during the COVID time, and her parents said she need not go for the exam, but that girl wanted to do her 10th exam. And I told her, Aisha, how are you going to do it? You have so many medicines to take. You've just come out of this serious brain infection, and for the next 9 months, she's supposed to be on the medication. And she said, no, doctor, I will do it, but just pick up my call when I have any doubts. In the next 1 month, she studied so well. And because it was the COVID year, that particular year, the exams were held late in May. And she cracked it. Not just that, she's now studying to become a lawyer. Isn't that amazing? This is what these children teach us. Now look at this miracle boy. Again, during the COVID time, he came to us. He fell down from the first floor. He came continuously having fits. And we thought, this boy is not going to make it. We had to, the team who were all in PPE had to intubate him and put him on the ventilator. And even an untrained eye can make out that he had a big skull fracture. And how did that happen? Look, this was a picture of his house. All he did was climb up the stairs. But when he reached the part near the balcony, he stood there and fell off. It was devastating for the parents, and he was COVID positive. That made things much worse. He had a stormy course in the ICU. This is him on the ventilator. But within 2 weeks, he was out of it. Not just that, he even reached the papers because he showed people how, despite having COVID and falling from the first floor, he actually made it. The last is about Destiny's child. This little girl came to us with fever and breathing difficulty, and parents said she was absolutely normal the previous day. Nobody understood what happened to her. She's a 1-year-old girl who was very well. They had a little vacation and they just moved into the house, and the next day this child was almost collapsed with fever and had a lot of breathing difficulty. She barely could cough and had a lot of phlegm in her mouth. Nobody understood what it was. So the doctors thought that she had brain fever and referred us to our center for the ICU. So we did the usual thing. We suctioned her, we put her on the ventilator, but something was not right. Again, this child also was COVID positive. So everyone said probably COVID has damaged her lungs, but her lungs were clear. She hardly needed any oxygen. There was something beyond. Looking at her eyes, her pupils were extremely small. She had excess amounts of secretions. And these things fit into a syndrome called as organic phosphorus poisoning, or OP poisoning, as we say. But where did this child get OP poison? So I went to the parents and I asked, usually OP is present in fertilizers. And I said, by any chance, do you think your child had access to a fertilizer and has poisoned herself, and that's why she landed this way? And they got really upset with us. They said, probably these people don't want to treat COVID, and that's why they're asking us weird questions. They said, look, our child was completely fine, and we've never poisoned her. She has no access to fertilizers. We live right in the city in Rajasthan. How can you ask us these questions? But I was very, very sure that there is something beyond this COVID. Her pinpoint pupils, excessive bronchial secretions, and that collapsed presentation that she had within a day did suggest poisoning. So we sent the acetylcholine esterase levels to diagnose this, and within 4 hours we got the report that it was extremely low, suggestive of poisoning. So I went back to the parents and I said, look, tell me what happened at home. Why did you all, where were you before this? And then they said, no, we never went on vacation. We had done the house cleaning. The pest control service had come. And so we went and stayed in our aunt's house and moved in yesterday. I said, pest control? Oh God, give me his number. And then they gave me his number. I called him up and I said, please send me a picture of what agent you applied. And this is what he sent, metacid. This was clearly an OP poison. Now, unfortunately, people use this even in cleaning purposes, which is not meant. It's a highly poisonous fertilizer, and it should be used with caution. Now, this person had used that at home, and little bits of it was still left in the corners. This is a crawling child, so she had crawled over, picked up a little bit, put it in her mouth. Even 1 gram is very toxic. So we started treatment not for COVID, but for the poisoning. And within no time, she was home and happy. She too landed up in the newspaper. These children teach us immense lessons, not just about medicine, but about grit and resilience. I feel blessed to be a children's doctor. Each one of them is a unique miracle. I could come this far, which is a very small journey compared to the wonderful journeys of my seniors and mentors. But I could come so far only because of the support of my 2 lovely girls, Anushka, who's 17 and is pursuing to be a doctor, and Anvita, who's in her 7th standard. And of course, Dr. Chandrasekar, who steers my life in different ways. My source, my parents, where I've learned all my values from. My pillars, my mother-in-law and my grandmother. Unfortunately, 2 years ago, I lost my grandmother to COVID, but she stays within me. Well, in all this journey, one thing that I forgot is my own health. This is the blood pressure reading even after starting medicines. At 45 years, being quite conscious of my diet and everything else that I do with no other bad habits, I was surprised that I had blood pressure. Of course, I didn't look after myself. There was lack of sleep and a stressful job. That's when I took it up as a challenge, not just to educate myself and our family, but various children in schools about how to eat better. My 5 on My Plate was a little program we started based on extensive research on USDA on how we need to eat healthy, which half a plate of fruit and vegetables, quarter grains, quarter proteins, and a cup of curds. There's a lot more to this. I propagated this in various schools. Not just that, followed it in my own home and when I carry my lunch. These are just snapshots of my lunchbox. So, but eating healthy was not enough for me. The reason I landed up in a mess was because of the lack of sleep and relaxation. So that's when I took into this new fitness journey to yoga. My mornings begin at 5 a.m. and I do run 5 kilometers. And my first ever marathon was the TCS. I loved every bit of it. Well, just when I thought my journey at Manipal was settling, Dr. Chandrasekar said, let's start our own hospital. That came as a big surprise. So last month, we moved on to our own hospital called DHEE. It is not DHEE, but it is DHEE. I think all of you have heard the Gayatri mantra, Dhiyo Yona Prachodayat. DHEE is the confluence of mind, body, and soul, a Sanskrit word. We believe at DHEE that when we have our mind, body, and soul come together, that's when we can be at the best of health. And when we have health, we have happiness. So that's where our tagline of healthier, happier, and working together. So this was the dream that we started, and DHEE began hardly a month ago. We already did our first 100 patients just yesterday, so it's been an exhilarating journey so far. Well, I don't know what the future lies, but I remember my father's word, Karmanye Vadikaraste Ma Paleshu Kadachana. What we can do is only our effort. Outcome can wait. Thank you so much for your attention.
Thank you, ma'am. That was a really motivating journey. We have an audience question from Sohan. He asks, how do you think the stereotype surrounding children and women's health affect the medical practitioners in diagnosis? And has the uh, attitude towards it changed over time? And is it changing for the better?
Okay, that question would probably require a day to answer. Yes, the entire realm has changed in healthcare. Let me focus on children because that's my domain. Have you thought about it? What children eat, how they play, and how they live has completely changed. They don't play in parks, they go to malls. They play in front of the screens, and they hardly have physical play. Today, 90% of the adolescents actually weigh more than me. So obesity is a huge thing. Children get blood pressure at a tender age of 14 and 15 years. They are far more sexually oriented at the age of 12 itself. So everything about childhood has changed. How they eat is completely changed. All they need to do is order on Swiggy and it comes home. So processed food has taken up as a huge thing. We all grew up eating 90% wholesome food, but what they don't realize is it's not the fat. It is the new tobacco, which is salt and sugar, which comes silently into the food. So there's this epidemic of salt and sugar rise in our children, dealing with a whole lot of problems. And how they relate to themselves and the environment has also changed. They hardly are in touch with nature. I think the biggest vitamin deficiency right now is vitamin N, which is nature's vitamin. We all grew up walking barefoot, touching mud and feeling the butterflies, but they don't. They don't have that first-hand experience. So if you know how the brain is formed, since they don't touch and feel, they're mostly on their screen, their brain development itself is completely different. Today, as soon as a child is born, we stick on the camera. So they are so well versed with technology. I call myself, a technologically challenged as compared to my children. Even today with teams, I kept asking them, I don't have an ID, do something, come, and then they set it up for me. But they are technological natives. They know everything about it. But that comes with a whole set of disadvantages. So yes, healthcare has completely changed. Better or worse, I'm not sure, but definitely there are a lot of options and we need to become aware, educated, and become very conscious about how we live our lives from now on.
Thank you, ma'am. That was quite insightful, and especially how women in health can change healthcare completely. It was a great start to our program today. Thank you, everyone, for joining us here. We'll continue with our next talk at 7:15. Thank you again, ma'am.
Thank you so much.
Thank you.
Hi. So good evening, everyone. I think we'll start now. Our next speaker is Dr. Poonam Parakh, an assistant professor in the Department of Obstetrics and Gynecology from the Dr. SN Medical College in Jodhpur, Rajasthan. Unfortunately, because of an electricity failure and due to sandstorm in Jodhpur, she wasn't able to join us today. However, we will be presenting a recorded presentation that she kindly recorded for us. And you can send the questions, any question that you might have on the on the presentation to us, and we'll try and contact her. Or any experts who are present in the meeting today can also try and answer the questions. So the topic for the next talk is PCOS.
Hi, good evening, everyone. First of all, I would like to wish you all a very happy International Day of Action for Women's Health. It's indeed a great honor and privilege to be a part of this symposium. Thank you, team IISc iGEM, for extending me this invite to deliver a talk on public health issue. This day, 28th May, was launched by women health activists who really wished that universal health should be made available to the females all over the globe. Not only should it be available, but it should be as a fundamental right of every female. The health should include not only the physical aspect, but also the mental, emotional, social, psychological, sexual, and reproductive health. Now, quickly coming to my topic of today, that is PCOS, which is polycystic ovarian syndrome, or PCOD, which is polycystic ovarian disease. Initially, it was polycystic ovarian disease, but to label a condition as disease, one has to be symptomatic. But since many of the patients, they go as asymptomatic, so the term was changed into PCOS. Why did I choose this topic of PCOS for today? PCOS is a public health issue with paramount reproductive, metabolic, and psychological impact. The global prevalence of PCOS is estimated to be somewhere between 4% to 20% in different areas of the globe. World Health Organization data suggests that approximately a big number, that is 116 million women, are being affected by PCOS globally. This data was set in August 2022, and this number is a big number, definitely. According to the National Health Portal of India, the prevalence rate of PCOS found in Maharashtra was about 22.5%. Though we do not have much data available because of the lack of surveys, but still the number of PCOS in India is very high. What is the definition of PCOS? This is a condition which is clinically marked by infertility, menstrual irregularities, excessive hair growth on face and body, there is presence of acne and obesity, and if ultrasound examination there is enlarged ovaries, and blood test would reveal a high level of male hormones. So this is basically a syndrome complex involving all these structures. What is the age that is affected by PCOS? PCOS, it mostly hits the adolescent age group females and the reproductive age group females. A study was conducted and it was found that about 50% of the females, they belong to adolescent age group from the 15 to 20, and then again 25 to 35, the females, they were high in number, but then after 35 the incidence of PCOS markedly decreased for these PCOS patients. Now, what is the most important concern regarding PCOS? That is its increasing incidence. It was found that the prevalence of PCOS has increased to about 65%. That is again a one big number over the past decade, and there is a high prevalence of obesity, hyperandrogenism, and infertility. Coming to the causes, what are the probable causes of PCOS? We really do not know the exact cause, what is causing PCOS, but then genetics do play an important role. Family history is to be taken into account, but most important are obesity, sedentary lifestyle, stress, lack of sleep. They are one important factors that are very important for PCOS. It has been found that urban Indian women, they are more at a higher risk because of the poor lifestyle, eating habits, and because of lack of physical activity. What are the symptoms associated with PCOS? PCOS involves almost all the symptoms. Most commonly, the first and the foremost, especially in the adolescent age group, it is the irregular periods or no periods at all. Initially, the patients, they are coming to OPD, they would say that they had menstrual cycles very regularly, but then gradually they had a period of amenorrhea, 1.5 to 2 months to 3 months, and then gradually at times even cessation of the routine periods occur. The reproductive age group would usually complain of difficulty in becoming pregnant, and that is primarily because of irregular ovulation or no ovulation that is occurring. Then there is excessive hair growth, which is a very common feature found, hirsutism, usually on the face, chin, chest, and at back. Obesity in all age groups, be it adolescent, be it reproductive age group. And with obesity, one thing very important is noted that obese patients are prone to become PCOS, and in turn, PCOS would again cause obesity and weight gain. So now there occurs a vicious cycle, and at times it's very difficult for the female to come out of this vicious cycle and break this cycle. So one has to intervene very strictly with the lifestyle modifications of diet and exercise. Then the other complaints are thinning of hair or hair loss from the head, and some of them would complain of oily skin and marked acne presence. How do we diagnose PCOS? There is no single test available, and so it includes a set of conditions in which the clinical history of menstrual irregularities and infertility and physical examination is concerned. Ultrasound picture would show a pearl of string appearance on the ultrasound, which is a very classical feature found in polycystic ovaries. Then blood test would help in diagnosing PCOS, in which there is increased level of androgens and testosterones and luteinizing hormone with a decrease in FSH. So these would help in diagnosis of PCOS. Is it a serious problem? Yes, PCOS is a very serious medical condition and it requires a proper timely treatment. The three main modalities of the treatment are: number one, lifestyle modification. If patient does not respond to lifestyle modifications, go ahead with medical management or surgical management. Many of the patients with PCOS, they even don't know that they're suffering from PCOS, and to screen these patients is become very important. Can PCOS be cured? No, it cannot be cured 100%, and only the symptoms, they can be managed up to an extent where we can even decrease at a later stage the metabolic syndrome conversion of this polycystic ovary syndrome. Now coming to the treatment, first and the foremost is the lifestyle changes. If the female is overweight, PCOS can be greatly cured by losing weight. Weight loss of about only 5% can also lead to significant improve in PCOS symptoms. So just go get started. Don't think much. Start with Zumba, yoga, aerobics, cycling, walking, swimming. Any type of activity is beneficial. It could be a subject of your choice, but then exercise is must. Now, what is body mass index calculation? How do we calculate this? This is weight upon height squared. So a healthy BMI is a must in order to decrease the symptoms for PCOS. A normal BMI of the person female should be around somewhere between 18.5 to 24.9. And if the female is obese, definitely a lot of issues have to be done to decrease the body mass index. What are the things recommended? Of course, exercises regularly and eating a healthy, balanced diet. What do we mean by balanced diet? It should include a lot of fruits and vegetables, whole food such as wholemeal bread, whole grains, cereals, brown rice. And for those who are non-vegetarians, they can take lean meat, fish, chicken. And even if the patient does not respond to diet on their own, it's better to take a dietitian's advice, get a diet chart noted, and of course the calorie input and the burnt exercises, the calories that are being burnt with exercises is to be recorded, and there should be of course a decline in some of the calories. Now certain do's and don'ts when we are eating: reduce the carb intake, get plenty of fiber in your diet, eat enough proteins, eat healthy fats if all fats are to be taken, eat fermented food, that is very helpful for the in decreasing in weight, practice mindful eating, and limit the processed food and added sugars. We have a large list of available foods which are good for fertility and decrease in weight. And what are the don'ts we have to be keep in mind? Don't eat fried foods, that is especially French fries, potato chips, corn chips, and for the non-vegetarians, fried chicken or fish, that is to be avoided. Saturated fats in the form of butter and margarine should be avoided. Even sweet candies, very sugary foods in the form of cakes, cookies, pies, and cold drinks, because many of times people are addicted to cold drinks and they take so much of sugar they are not even aware of it, so it has to be cut down up to the maximum. Now coming to some myths, there are a myth that if you lose weight you will get rid of PCOS. No, again, PCOS is not 100% curable, but yes, definitely most of the symptoms and later on stages with the metabolic complications can be declined to a maximum. So we have said lifestyle changes do work a lot. How? By improving the body composition, by restoring the insulin sensitivity, because the tissue had become insulin resistant. Now again, insulin sensitive tissues have become enhanced. Adipose tissue lipolysis occurs, androgens would be decreased, menstrual cycles will become more regular now, fertility chances will increase, there would be improved mood, and depression would be less. So in 2018, there were international evidence-based PCOS guidelines that were laid down. Most of them we have already discussed in the form of healthy eating, physical activity, lifestyle interventions of diet and exercise, 5 to 10% decreased. Now what is important is one must adhere to these lifestyles, because one time weight loss is okay, good, but then if you don't adhere to these lifestyle interventions, again you are bound to increase the weight, and then the same thing, PCOS is going to come back again with full-blown complications. So the healthcare professionals' interactions should be very much patient-centered and respectful. Healthy lifestyle offers health and quality of life benefits. All the healthcare professionals, they should share a joint responsibility, of course, to make the females aware of this condition and to treat them accordingly. Having said a lot of things about food, eating right food at the right time, proper exercises, relaxation techniques. Now, what if the patient still does not respond? Still, she's not ovulating properly, she's having her regular cycles. Then, of course, second line of management is medicines. In the medicines, first of all, we have the contraceptive pills, which are to be recommended to take to tell the patient to take them regularly, to have a regular period. Now, many a times the patient says, okay, so what if I do not take any medicine and I would stay in a period of amenorrhea for say 2 months, 3 months? But then we have to counsel that it's the long-term effect of estrogen on the endometrium at a later stage will now cause endometrial cancers. So it is very essential for the patient to be given progesterones, so that this would cause withdrawal bleeding and continuous exposure of estrogen would be stopped. So either you give contraceptive pills in the form of combined pills, estrogen progesterone pills together, or progesterone only tablets, a short course can be given to have a withdrawal bleeding. Fertility problems, if they are associated, then of course ovulation inducing drugs are given in the form of clomiphene and letrozole. What do? They cause increase in the monthly release of an egg from the ovaries, and then fertility chances would increase. Now this is the algorithm which is for PCOS. If the patient has BMI of more than 30, of course, the first line treatment goes for weight loss. Many times just simply weight loss and the patient conceives. Now, if the patient still does not conceive, she has a BMI of 30, then treatment with clomiphene citrate or letrozole is started, that is ovulation induction drug. And what if even with clomiphene the patient does not conceive? The next step is either give gonadotrophins or laparoscopic ovarian drilling. And then last is of course in vitro fertilization. Then there are even certain medicines associated along with clomiphene. We can give tablet metformin, which is usually used to treat type 2 diabetes. But its main action is it would lower the insulin and blood sugar level, thereby leading to increase in the stimulation of ovulation. Also, the chances of miscarriage would decrease with metformin, and at a later stages, because of the decrease in the cholesterol levels, it is known to decrease the rate of heart disease. So metformin is one medicine which is really important along with clomiphene. How do we treat unwanted hair growth and hair loss? We can again give combined OCPs, that is used to treat the excessive hair growth. Then there is a cream called eflornithine, which is used to slow down the hair growth of the unwanted facial hair. But the hair that are already present, then one can go ahead with plucking, shaving, threading, or laser removal. And if there is hair loss from the head or the scalp, a minoxidil cream is recommended to them. Very rarely at times, anti-androgens may also be required to stop the excessive hair growth in the form of cyproterone acetate, spironolactone, flutamide, finasteride. So it all depends on the amount of involvement of the symptom and accordingly the choice that is to be made by the doctor. Even we have weight loss medicines in the form of tablet orlistat, because if the weight is not responding to diet and exercise alone, then medicines are to be prescribed to these patients. Then also we have cholesterol lowering medicines in the form of statins, which would decrease in the level of cholesterols in the blood and thereby decreasing the chance of stroke and heart attacks in the later stages. Treatment for acne, we have available creams and lotions. Now coming to the third aspect, third modality of treatment, that is the surgery. The patient, if she does not respond to lifestyle modifications, which is number one treatment. Number two is the medicinal treatment in the form of either clomiphene or letrozole for fertility and the oral contraceptives and progesterones for regular periods. Now the patient still not responding. The third modality is surgery. What do we do in surgery? This is a minor surgical procedure called laparoscopic ovarian drilling. Here, what do we do is we destroy some of the peripheral ovarian tissue with heat or laser. And this tissue has been known to produce androgens. Now, when there will be a decline in the androgens or the male hormones or the testosterone luteinizing hormones will be decreased, consecutively FSH increases and a correction of the hormonal imbalance occurs and regular ovulation would now start. So this helps in reviving the fertility of the patient. Last treatment, still the patient is not responding to even laparoscopic ovarian drilling, then of course IVF is suggested to the patient. What do we do in IVF? It involves the eggs, they are being collected from the ovary, they are fertilized outside the womb, and then the fertilized egg or single or multiple eggs, they are placed back into the wombs. Now definitely if multiple eggs would be placed back, then there would be chances of twins and triplets in PCOS. So the pregnancy complications would occur. Do we have some individual pregnancy risk? Yes, again, we have found that PCOS patient, when they become pregnant, they are more prone to develop hypertension, preeclampsia, diabetes, and abortion rate is comparatively high. Compared to the obesity and a non-obesity patient, obese patient definitely have a higher chances of pregnancy complications. And so it is very much recommended that if a patient is planning for a pregnancy and she has PCOS, then she would be advised to decrease the weight before she plans for a pregnancy. Then we have a myth that it's only affecting overweight women. No, that's not the story. Even the thin patients can be affected. So PCOS does not discriminate and can affect the women of all shapes and sizes. The question arises, do we investigate the lean PCOS females for metabolic abnormalities? Then yes, because again at a later stages when this reproductive abnormality converts into a metabolic abnormality, so these even lean and thin patients, they have to be treated, they have to be detected for metabolic abnormality, and then lifestyle modifications are advised to these patients as well. Then many of the patients would ask, what is the best age to get pregnant with PCOS? So that is before 30. If you are planning a pregnancy, as soon as possible it has to be planned, because it's possible to conceive till the age of 37. But then the fertility itself declines very much after 32, and after 37 there is a steep decline, so chances of getting pregnant is markedly decreased. Some of those patients, they would come up with the questions, does it have an impact on memory? Yes, PCOS does have some degree of brain function changes as well in the form of cognitive functions and emotional disturbances. There is poor executive functioning and memory. There would be anxiety syndromes, depressive symptoms to these patients. What is the prognosis? How does this disease progress into? As we had already said, adolescence there is menstrual irregularities, hirsutism, acne. Later on in the reproductive age, there is infertility, miscarriage, pregnancy complications. Now, when these patients would become postmenopausal, there is increased chances of obesity, insulin resistance, diabetes, dyslipidemias, and hypertension. And even it has been found that there is increased mortality due to cardiovascular diseases and stroke. So long-term complications, there could be diabetes, dyslipidemias, cancers, mood disorders, heart disease, hypertension, liver diseases. So finally, we end the topic here, and the take-home message goes as polycystic ovary syndrome is a public health issue with paramount reproductive, metabolic, and psychological impact. Genetics does play an important role, but then sedentary lifestyle is one big factor. Obesity and stress plays an important role. And the most important today's topic was lifestyle modifications, which plays the key role for the treatment of PCOS in the form of taking right food at the right time, taking time to properly exercise, giving time to oneself for relaxation techniques, for yoga, for meditation, and then sleep, which is very important. Thank you. And this talk is being delivered from the city of Jodhpur, and this is a tourist place. So if any one of you happens to visit to Jodhpur, I would recommend you to visit two main tourist attractions, which are the Umaid Palace and the Mehrangarh Fort. Thank you.
Yeah, thank you, Dr. Poonam, for that amazing talk. So if there are any questions from the audience, please send the questions to us. The experts in the audience can try and answer the questions. If not, we will contact Dr. Poonam directly and get back to you later. Yes, Dr. Ammembal, do you have a question for us?
What would be the role of research or scientific research in polycystic ovarian syndrome? Apologies in advance if this is not already been addressed by the speaker. Like, what are the areas where actually science can make a difference at present? Because the reality is, from my personal experience, polycystic ovarian syndrome is an extremely difficult condition to diagnose as well as treat, because it's pretty vague in terms of definition and all other aspects. So basically, a lot of unanswered questions remain, especially in what really causes polycystic ovarian syndrome. So I would have liked the speaker or any expert to address this particular aspect.
Thank you for your question. We will relay this to the speaker who wasn't able to make it to the talk today.
No worries.
And we will get back to you as soon as we get an answer to this. Thank you.
Thank you.
Okay then. Thank you to everyone who's stayed with us so far. I hope all the talks so far have been enlightening and have shed some light on various facets of human health. Now, without further ado, I'd like to introduce our next speaker, who is Dr. Akshata M.K. Ammembal. And She's an MBBS, currently working as a medical intern, and she's here to shed some light between the intricacies and interplay of a woman's health and her career, how focusing on a woman's health can allow her to reach her potential as leaders. So yeah, Dr. Akshata, over to you.
Yeah. Am I audible and visible?
Yes, doctor. Yeah.
Perfect. Thank you very much for the introduction. It's great to be with all of you here today. Before I start my talk, I would like to thank the iGEM team of IISc for letting me speak today. So I'm going to be talking about the modern young woman and the reproductive health challenges she would face. And the reason I chose this particular topic is because I feel that today's audience would resonate with it as much as I do. So during the talk or even after it, just let me know if you have any queries and I would be open to answer them. I would like this particular talk to be as interactive as possible, so don't hesitate to ask any queries. So the young woman of the 21st century faces specific challenges, a myriad of challenges for sure, but like a set of specific challenges, which include marital issues, cultural challenges, especially in a country like India, specific sexual and reproductive issues, as well as diseases that would afflict young women. So, and as a young, educated woman enters the professional arena, she would expect that the world would welcome her with a lot of pride and anticipation. However, regrettably, this is not usually the case, especially when you compare it to a young man in the same situation. And this young woman immediately becomes a prisoner to the challenges not of her own making. And even girls with exceptional abilities and aptitude are weighed down by these challenges, which have multi-dimensional aspects. And eventually she is forced to succumb. She loses motivation to succeed. And these challenges, I feel, are particularly evident in developing countries, like India. And the cultural norms here are so rigid that young women would expect covert as well as overt pressure for arranged matrimony. And most young women end up complying, as there is often no freedom to date or even socialize in an open environment. This makes them feel that eventually it would be very difficult to find someone that they would want to be with, and they would be very insecure about finding a suitable mate in the distant future. And this situation becomes more complicated when biological issues are added into the existent mixture. Many women are scared that by indefinitely postponing pregnancy, they would be unable to conceive. And sadly, such fears are reinforced by IVF clinics, which spread misinformation that it is difficult to conceive naturally after the age of 30. And other than the fear of not being able to get pregnant, you also have the additional fear that in addition to delaying pregnancy, you would also be increasing the risk of certain other diseases like endometriosis, and even some cancers like breast cancer and endometrial cancer. And the concern about such risks actually compels many health professionals to prescribe pregnancy as an insurance against developing such diseases. And if you think about it, in reality, it is impractical to expect the modern young woman to excel in her career and profession and simultaneously have a successful reproductive journey. And even if a young woman ends up marrying the right person and a supportive partner, she's highly likely to end up having to take several career breaks and significant ones at that. So knowing what lies ahead of us, we have to come to the million-dollar question. The million-dollar question here is, how does a young woman plan her life ahead, and whether it is possible to have the cake and eat it too. I think the most important thing here is financial freedom, because financial freedom is at the heart of empowerment of the young woman, and there should be no illusion about the consequences of compromising on this particular freedom, because one may be accused of aggressive feminism when you proffer this particular argument, but it isn't difficult to see the lives around us and how the lack of financial freedom in women can actually affect them. It is not uncommon to see domestic abuse of married women who are insecure and have low self-esteem, and the sudden death of a working partner, of the only earning member, could make the woman extremely vulnerable and helpless. And it would be beneficial, and it would have been the best case scenario if the society as well as the government would create an environment that would be conducive for the modern young woman to go after both the fulfilling career as well as a fulfilling family life. But sadly, such utopia only exists in our dreams. But there are certain countries like Scandinavian countries which have made significant progress in this particular aspect. So if we're talking about women in India, in the absence of such a conducive environment, it is left to the woman as well as like-minded organizations to make sustained efforts in this front. The first practical aspect is to educate the immediate family, especially the parents, about the need for financial and professional development of the young woman. This approach may help to secure moral as well as logistic support for young women, and this may also eventually help in finding the right partner for the young woman, as well as to help her in finding care during pregnancy as well as during childcare. The next important aspect is to understand the legal rights enshrined in the Constitution and specific legislation to help and support young women. Young women who are fully aware of their rights may be less vulnerable to bullying in the workplace as well as home. And let me tell you, the bullying is not hidden, it is very blatant, and it is necessary for women in the workplace to recognize this. Not only in the workplace as well as home, but especially in the workplace. The third important step is to understand one's own desires, wishes, and aspirations. And this is a very difficult prospect, mostly because one has to be able to introspect regularly about this. But it's always best to make up one's own mind about it than following the herd. Even if a young woman wants to prioritize her family over a career, it is highly advisable that she should try to develop sufficient financial security measures for herself and taking all worst case scenarios into a consideration. The fourth aspect would be to address medical options to allow delaying pregnancy and reducing the risk of developing diseases that I've already mentioned, like endometriosis, breast cancer, endometrial cancer. So I think one of the most fundamental things that can be done, but also something that is particularly hard in today's day and age, is maintaining a healthy lifestyle and avoiding obesity. And this may mitigate some of the risks, particularly that of cancer, because cancer is a very multifaceted disease. So you would have many things which cause the risk. Obviously, you would have inherent risk to having cancer for being a woman, and this can be increased to an extent by delaying pregnancy and other such things. But lifestyle also plays a very big part in the causation of cancer. Freezing of one's own eggs is increasingly being considered by many women as an alternative to taking career breaks and entering into early relationships. This is also an up and coming thing which should be considered. And one could also consider use of short doses of oral contraceptive pills to reduce the risk of endometriosis. As I'm sure everyone knows, iGEM is, I think the iGEM team of IISc is working on endometriosis. And so endometriosis actually is pretty common, and it's only on the rise because of the inability to balance a woman's career with her family. So I think endometriosis is definitely something that should be taken into consideration. And like I said, one could consider using short courses of contraceptive pills. But even this particular option has its own, it has its own share of side effects. So all in all, it is evident that being a young woman in the 21st century is like being a funambulist on a tightrope, high up in the sky, and it comes with its set of adversities. However, I think that knowledge of these challenges is the first step to achieving a healthy and accomplished life. And that's how I would like to end my talk.
Yeah. Thank you, Doctor, for that great talk. And you picked up such a sensitive issue which has so many facets, and you dealt with it in such a sensitive manner, which is difficult considering all the socio-cultural pressures that a woman has to face. Pair that with the financial and reproductive issues that you mentioned. So yeah, we're really grateful for your perspective on the topic. And if anyone's unfamiliar, I believe you were there with us even during our brainstorming sessions, and your guidance has been very helpful for us, for the entire IISc iGEM team. So we're very grateful for that as well. Thank you. And everyone else who's been, yeah.
Yeah, I would be great. I would be great. It would be a great opportunity for me to be of any help for this particular project, because it's also very dear to my heart, because I also do want to take up a career in obs and gynae, and I also see that endometriosis is on the rise, and it severely affects the quality of life of young women. So it's a great initiative on your part, on the iGEM team's part, to actually look into this disease and try to find a solution. So hats off to you guys for that.
Thank you, Doctor. But again, your guidance has been very, very helpful, and we all appreciate that. And everyone else who's been with us so far for the talks, thank you for your participation. There were a few technical glitches on the platform, so we apologize for that. But yeah, your participation has made this event a success. Stay tuned with iGEM IISc's team for more such events and programs.